Hi, I am Jose Luis Luna. I am a Univac medical student, and I'm going to talk about a clinical case of splenomegaly. A 13 years old male music teacher has had temperature between 37.8 and 38.5 degrees in the afternoon for the past 6 months. The patient looks deteriorated and febrile. The only symptom reported is fever, and he also reports having seen multiple doctors in the last 6 months. The first doctor told him it was an infection and he prescribed paracetamol and ampicillin. The second doctor sent him a complete blood count, or CBC, and found a little anemia and elevated leukocytes. He prescribed sulfa and nemolizumab. He didn't improve. The third doctor checked him and told him that he had a tumor. He ran some tests and chest X-ray and found elevated leukocytes, and the X-ray was normal. Due to urinary tract infection, he prescribed 7 vials of gentamicin. Well, now the improvement was partial, but the fever came back. Now he also complains of exhaustion, lost weight, pain, and in the abdomen below the left rib, and a mass was detected in there. On palpation, a 20 centimeters tumor was palpable in the upper left quadrant of the abdomen, not painful, mobile, and seems to be located in the spleen. Well, his father died of alcoholic cirrhosis, and his mother is alive but is diabetic. He has 7 siblings, and 4 of them are diabetic too. Okay. The physical examination, the general appearance, the patient is febrile and deteriorated. He has 13 years old. His height is 1.76 meters, and his weight is 18 kilograms. The vital signs, his temperature is 13.8 and 38.5 degrees. His pulse is 87 beats per minute, and his blood pressure is 120 over 70 millimeters of mercury. His respirations are 18 breaths per minute, and his oxygen saturation is 98% in a room air. In the hand examination, remember, hand is head, eyes, ears, nose, and throat is unmakeable. Cardiovascular is normal. He had a regular rate. In the abdomen, a mass is present. Now the extremities is no clubbing, no cyanosis or edema. The neurologic exam is non-focal. Well, the splenomegaly is defined as an increase of the size of the spleen greater than its normal dimensions. In adults, they are 12 per 7 per 3.5 centimeters, with approximate weight of 115 grams and a volume of 300 millimeters. Well, this organ is found on the left side of the body, below the rib cage. The spleen is the largest lymphatic organ in the body, and in addition to participating in the primary immune response against microorganisms of foreign proteins. It has another functions, among which it's a filter of the blood to remove the erythrocytes. The erythrocytes are all erythrocytes from the circulation, as well as other antibody-bound blood cells. The blood enters in the spleen and is filtered through the splenic cords and exposed to immunological active cells. Well, now causes of splenomegaly are the portal hypertension due to the chronic liver disease, lymphomas, leukemias, myeloproliferative neoplasm infections, congestions or inflammation, and thrombosis of the splenic vein. There are types of cancer that can be benign or malignant. For example, lymphoma. Lymphoma is a primary involvement of the spleen by lymphoma is much less common than a secondary involvement, accounting for less than 1% of all lymphomas. The primary splenic lymphoma usually represents a non-Hodgkin lymphoma or B-cell origin. The secondary involvement of the spleen is much more common and is seen in association with enlarged lymph nodes in the rest of the abdomen. Now, malignant tumor is the angiosarcoma. Although grade angiosarcoma is the most common primary, non-hematopoietic malignant tumor of the spleen. This is highly aggressive tumor with poor prognosis. Splenomegaly is commonly found. A spontaneous splenic rupture has been reported in approximately 25% of the patients. Well, now for diagnosis, splenomegaly is detected during a physical exam. The doctor can feel it, and he or she examines the upper left area of your abdomen. It's also detected from blood tests, such as a complete blood count to detect the number of red blood cells, white blood cells, and platelets in the body. Now, ultrasound or computer tomography or CT scan is used to help determine the size of the spleen and whether it is pushing on other organs. Magnetic resonance is used to track blood flow through the spleen. And now in this case, an ultrasound was used to confirm this diagnosis. Thank you.